Integrated Program Design Concepts. The purpose of this presentation is to provide the health and fitness professional with the fundamental concepts related to program design and to allow the fitness professional to select and administer the appropriate program design for all clients. Following this presentation, the participant will be able to define and describe the acute training variables within the OPT model, describe the stages and phases within the OPT model, and design programs for each phase of training. Traditionally, most training programs are based on the experiences of the health and fitness professional, whether he or she is a bodybuilder, group exercise instructor, powerlifter, Olympic lifter, or an athlete. This has led to many scientifically unsupported training programs that have created confusion for the health and fitness professional. In order to be safe, effective, and productive, all health and fitness professionals must be competent at designing programs for a variety of clients. This entails the proper utilization of acute variables and exercises in a structured, progressive manner. Program design becomes simple when using a structured, scientifically based program design model. Program design. Program design simply means creating a purposeful system or plan to achieve a specific goal. The key words here are purposeful system. The purpose of a training program is to provide a path for the client to achieve his or her goal. Providing a path requires the health and fitness professional to have a comprehensive understanding of some key concepts. First, acute variables. What are they? How do they affect the desired adaptation? And how do they affect the overall training program? Second, periodization and the OPT model. How and why must the physiological, physical, and performance adaptations of stabilization, strength, and power take place in a planned, progressive manner to establish the proper foundation for each subsequent adaptation? Third, the 5 phases of training in the OPT model. How do these phases promote specific adaptations, and what are the acute variables for each of the phases? And fourth, application. Selecting the right exercises, selecting the right acute variables, and applying both in a systematic manner to different populations with different goals. Program Design Concepts, Part 1. If a health and fitness professional has a proven system that he or she can follow, the needed information can simply be plugged in without the worry of using the correct formula for success. This is exactly what the OPT model provides. The remaining portions of this chapter will detail acute variables of planned fitness training or periodization as it relates to the OPT model, the 5 phases of the OPT model, and how to apply the OPT program design model to various goals. Starting with acute variables. Acute variables are important components that specify how each exercise is to be performed. Acute variables are the most fundamental components of designing a training program. They determine the amount of stress placed upon the body and, ultimately, what adaptation the body will incur. Acute variables include repetitions, sets, training intensity, training volume, repetition tempo, rest interval, exercise selection, exercise order, training duration, and training frequency. Starting with repetitions. A repetition is one complete movement of a particular exercise. Most repetitions will involve the 3 muscle actions, concentric, isometric, and eccentric. Repetitions are simply a means to count the number of movements performed in a given amount of time. They can therefore be a means to count the time the muscles are under tension. Each phase of training in the OPT model has specific goals, and therefore requires a specific number of repetitions to achieve these goals. The number of repetitions performed in a given set is dependent upon the client's work capacity, intensity of the exercise, and the specific phase of training. Research demonstrates that training in a specific repetition range yields specific adaptations. Therefore, depending on the goal of the individual and the phase of training, it is possible to define a specific repetition range. For example, if one is trying to elicit stabilization adaptations, 12 to 20 repetitions would be appropriate. If strength adaptations are the goal, then 1 to 12 repetitions would be appropriate. If the goal is power, then 1 to 10 repetitions would be the appropriate range. Next are sets. A set is a group of consecutive repetitions. The quantities of the other acute variables, such as repetitions, training intensity, number of exercises, training level, and recoverability, determine the number of sets an individual performs. There is an inverse relationship between sets, repetitions, and intensity. The individual usually performs fewer sets when performing higher repetitions at a lower intensity, and more sets when performing lower repetitions at a higher intensity. Fewer sets, higher repetitions, and lower intensities generally lead to endurance and hypertrophy adaptations. A high number of sets, lower repetitions, and higher intensities lead to strength and power adaptations. With that said, if the goal is stabilization, then 1 to 3 sets would be appropriate. If the goal is strength, then 2 to 6 sets would be the appropriate range. And for power adaptations, 3 to 6 sets would be appropriate. Program Design Concepts, Part 2. Training intensity is one of the most important acute variables to consider when designing an integrated training program. Training intensity is defined as an individual's level of effort compared to their maximum effort. The specific training phase and an individual's training goal will determine the number of sets and repetitions for an exercise. Intensity is then determined by the number of sets and repetitions to be performed, which is based on the individual's specific training goals. For the goal of stabilization, an intensity of 50 to 70% of one's 1 repetition maximum, or 1 RM, would be appropriate. If the goal is strength, then 70 to 100% of one's 1 repetition maximum would be appropriate. If the goal is power, a range of 30 to 45% of one's 1 repetition maximum, or up to 10% of one's body weight, would be an appropriate intensity. Training in an unstable environment, as seen in the stabilization phase of the OPT model, can also increase the training intensity because it requires more motor unit recruitment and muscle activity for joint stabilization. This may also lead to more energy expenditure per exercise. Repetition tempo refers to the speed with which each repetition is performed. This is an important variable that can be manipulated to achieve specific training objectives, such as power, hypertrophy, stability, and endurance. The OPT model places a major emphasis on the repetition tempo spectrum, as it has a significant impact on the functional outcome of the stressed tissues. By emphasizing eccentric and isometric muscle actions at slower velocities during the initial stabilization phases of training, more demand is placed upon the connective tissue as well as the stabilizing muscles, and better prepares the nervous system for functional movements. This is important for building the appropriate structural and functional foundation for more specific forms of strength and power training that will follow. Tempo is expressed by listing the number of seconds it takes to complete the eccentric portion of the movement, first number, followed by the isometric portion, the second number, followed by the concentric portion, the third number. So if the goal is stabilization, then a slow tempo, 4 seconds eccentric, 2 seconds isometric hold, and 1 second concentric would be appropriate. As one progresses up the model, the speed of the movement can increase. For example, if the goal adaptation is strength, then a tempo would be moderate, or 202. If the goal is power, then the tempo is fast or explosive, delineated by XXX. Next is the rest interval. The rest interval is the time taken to recuperate between sets and/or exercises and has a dramatic effect on the outcome of the training program. Each exercise that is performed requires energy. The primary type of energy used during training depends on the training phase, intensity, and goal. Power and maximal strength adaptations may require up to 5 minutes of rest between sets and exercises for optimal ATP-CP recovery, depending on the client's level of fitness. Hypertrophy adaptations are maximized by decreasing the rest interval between 45 seconds to 5 minutes between sets and exercises, but are dependent on the load being used. Stability and endurance adaptations could range from 0 seconds if performing a circuit training routine for caloric expenditure to 1.5 minutes of rest. Next is training volume. Training volume is the total amount of work performed within a specified time period. It is extremely important to plan and control training volume to prevent overtraining, as all training is cumulative. Training volume varies among individuals and is based on the training phase, goals, age, work capacity, recoverability, nutritional status, and injury history. One of the most important training concepts to remember is that volume is always inversely related to intensity. In other words, you cannot safely perform high volumes of high-intensity exercises for any extended length of time. For example, if your goal is stabilization, one could perform 36 to 75 total repetitions per exercise, lower intensity, higher total number of repetitions. If the goal is strength, the total volume begins to decline slightly as the intensity increases, 8 to 36 total repetitions per exercise. Finally, if the goal is power, the highest intensity, the total volume drops to 6 to 30 total repetitions per exercise. Next is training frequency. Training frequency refers to the number of training sessions that are performed over a given time period, usually 1 week. The number of training sessions per week per body part is determined by many factors, including training goals, age, general health, work capacity, nutritional status, recoverability, lifestyle, and other stressors. Research on training frequency indicates that the optimum training frequency for improvements in strength is 3 to 5 times per week. There's no significant difference noted between 3 days and 5 days. Other research indicates that training at least 1 to 2 times per week is sufficient to maintain the physical, physiological, and performance improvements that were achieved during other phases of training. Next is training duration. Training duration has 2 prominent meanings: the time frame of a workout, including warm-up and cool-down, and the length of time spent in one phase of training. The training duration for a workout is a function of the number of repetitions, number of sets, number of exercises, and the length of the rest intervals. For example, if a program included 3 sets of 12 repetitions at a 4-2-1 tempo with 30 seconds between sets, and one performed 7 exercises in the workout, then the total training duration would last 25 to 40 minutes, excluding the warm-up and cool-down. Training programs that exceed 60 to 90 minutes, excluding warm-up and cool-down, are associated with rapidly declining energy levels. This causes alterations in hormonal and immune system responses that can have a negative effect on a training program, or overtraining. Lastly is exercise selection. Exercise selection is the process of choosing exercises for program design that allow for the optimal achievement of the desired adaptation. It has a tremendous impact on the outcome of the training program. Therefore, exercises should be specific to the training goals and based on the principles of the exercise selection continuum. If the goal is stabilization, then the exercises used for the goal would be performed in more unstable yet controllable environments. Some examples would include a ball dumbbell chest press, a ball dumbbell row, or a single-leg overhead press. Keep in mind, one's physical capabilities need to be taken into account before utilizing these exercises. If an individual possesses extremely poor stabilization capabilities, then they may need to start in a more stable environment, such as a machine or a bench, and progress to these more unstable modalities as they develop higher stabilization capabilities. If the goal is strength, then the exercises used for the goal would be performed in more stable environments. This will place a larger emphasis on the prime movers, enhancing prime mover strength and hypertrophy. Some examples would include a barbell bench press, a seated lat pull-down, or a leg press. If the goal is power, then the exercises used for the goal would be total body exercises performed in an explosive fashion. Example exercises would include a medicine ball chest pass, a wood chop throw, or a squat jump. Periodization and the OPT model. The science behind the OPT model of program design lies in the concept of periodization. Periodization is a systematic approach to program design that uses the general adaptation syndrome and principle of specificity to vary the amount and type of stress placed on the body to produce adaptation and prevent injury. Periodization varies the focus of a training program at regularly planned periods of time to produce optimal adaptation. It involves 2 primary objectives. 1, dividing the training program into distinct periods or phases of training, and 2, training different forms of strength in each period or phase to control the volume of training and to prevent injury. To accomplish these objectives, a client's training program should be organized into a training plan that involves long-term and short-term planning. A training plan is a specific plan that a health and fitness professional uses to meet the client's goal. An annual plan organizes the training program over a one-year period. Each month within the annual plan is further broken down into periods of training called monthly plans. The monthly plan details the specific days of each workout, showing the client exactly what phase of the OPT model will be required each day of the week, as well as when the reassessment will occur. Each monthly plan will also illustrate one's weekly plans, which are the specific workouts that the client will do for that week. The weekly plan gives the client a picture of exactly what phases will be used in his or her workout for that period of time. Much of the literature regarding periodization refers to dividing the training program into specific cycles termed macro, meso, and microcycles. For ease of understanding, a macro cycle is the largest cycle and typically covers a year-long period of training. The macro cycle is divided into mesocycles, which are typically 1 to 3 months in length. Each mesocycle, in turn, is divided into microcycles, which are usually a week in length. The OPT model. The different periods of training seen in a traditional periodization model include a preparatory period, a hypertrophy period, a maximum strength period, and a power period. The OPT model seen in a phase-specific model of training includes 5 different phases of training. These phases systematically progress all clients through the 3 main adaptations of stabilization, strength, and power. The first level of training in the OPT model focuses on the main adaptation of stabilization, or anatomical adaptation, and is designed to prepare the body for the demands of higher levels of training that may follow. This period is crucial for all beginners. In addition, it allows the body to rest from more intense bouts of training. The focus of stabilization training includes correcting muscle imbalances, improving stabilization of the core musculature, preventing tissue overload by preparing muscles, tendons, ligaments, and joints for the upcoming imposed demands of training, improving overall cardiorespiratory and neuromuscular condition, and establishing proper movement patterns or exercise technique. The stabilization level of training in the OPT model consists of 1 phase of training, stabilization endurance training. Stabilization endurance training should be used for the beginning client who may possess muscle imbalances, lack postural control, and stability. This phase of training focuses on increasing stability, muscular endurance, and increasing neuromuscular efficiency of the core musculature. The acute variables used at this phase of training would include lower sets, 1 to 3, higher repetitions, 12 to 20, lower intensities, 50 to 70%, and exercises performed at a slow tempo, 4-second eccentric, 2-second isometric, and 1-second concentric. The rest intervals would last between 0 seconds, if performing circuit training, to 90 seconds. Refer to the program design chapter in your textbook for the complete acute variable table for this phase of training. The second level of training in the OPT model focuses on the main adaptation of strength, which includes strength endurance, hypertrophy, and maximal strength training. The focus of the strength period of training is to increase caloric expenditure, increase muscle size, and increase muscle strength. The strength period of training in the OPT model consists of 3 phases. Phase 2, strength endurance. Phase 3, hypertrophy. And Phase 4, maximal strength. Phase 2, strength endurance training, is a hybrid form of training that promotes increased stabilization endurance and prime mover strength. This form of training entails the use of superset techniques, where a more stable exercise is followed immediately with a stabilization exercise with similar biomechanical motions. An example would be performing a barbell bench press immediately followed with a push-up. This style of training allows for increased motor unit recruitment after the prime movers have fatigued and enhances dynamic joint stabilization while improving prime mover strength. The acute variables used at this phase of training would include low to moderate number of sets, 2 to 4, moderate repetition range, 8 to 12, moderate intensities, 70 to 80%, and exercise is performed at both a moderate and slow tempo, 2-0-2 for the strength exercise and 4-2-1 for the stabilization exercise. The rest intervals would last between 0 seconds if performing a circuit to 60 seconds after each superset. Refer to the Program Design chapter in your textbook for the complete acute variable table for this phase of training. Phase 3, hypertrophy training, is specific for the adaptation of maximal muscle growth, focusing on high levels of volume with minimal rest periods to force cellular changes that result in an overall increase in muscle size. Keep in mind that this phase of training is optional depending on the goals of the client. The acute variables used at this phase of training would include moderate to high sets of 3 to 5, moderate repetitions 6 to 12, moderate to high intensities 75 to 85%, and exercises performed at a moderate tempo 2-0-2. The rest intervals would last between 0 seconds if performing a circuit to 60 seconds. Refer to the Program Design chapter in your textbook for the complete acute variable table for this phase of training. The maximal strength training phase, phase 4, focuses on increasing the load placed upon the tissues of the body. Maximal intensity improves recruitment of more motor units, rate of force production, and motor unit synchronization. Maximal strength training has also been shown to help increase the benefits of forms of power training used in phase 5. As with hypertrophy training, this phase of training is optional depending on the goals of the client. The acute variables used at this phase of training would include high sets of 4 to 6, low repetitions 1 to 5, high intensities 85 to 100%, and the exercises performed as quickly as can be controlled. However, keep in mind that due to the heavy loads being lifted, the weight will not move very quickly. The rest intervals would last between 3 to 5 minutes due to the high intensities. Refer to the Program Design chapter in your textbook for the complete acute variable table for this phase of training. The third level of training is power and is designed to increase speed of muscle contraction. This form of training uses the adaptations of stabilization and strength acquired in the previous phases of training and applies them with more realistic speeds and forces that the body will encounter in everyday life and/or sport. The goals of power training include 1. Increase the velocity of movements, and 2. Increase the rate of force production by increasing the number of motor units activated, synchronization, and the speed at which they are excited. Phase 5 focuses on both high force and velocity to increase power. This is accomplished by supersetting a strength exercise with a power exercise for each body part, such as performing a dumbbell bench press superset with a medicine ball rotation chest pass. The acute variables used at this phase of training would include moderate to high sets of 3 to 5, low to moderate repetitions, 1 to 5 for the strength exercise, 8 to 10 for the power exercise, with high intensities, 85 to 100% for the strength exercise, and either 30 to 45% of one repetition maximum, or 10% of body weight, for the power exercise, with the exercises being performed as quickly as can be controlled. The rest intervals would last between 1 and 2 minutes between each superset. Refer to the Program Design chapter in your textbook for the complete acute variable table for this phase of training. Applying the OPT model. The OPT model is a proven, easy-to-use system of periodization that can be used to create programs for clients with various goals. While the understanding of these concepts is paramount, what matters the most is the ability to apply the information in multiple situations to a variety of clients and goals. These include body fat reduction, increase in lean body mass, and general performance. The goal of reducing body fat requires clients to follow the simple principle of burning more calories than they consume. The best way to increase the calories burned is to move more. Weight training provides an extremely potent means to burn calories when it's combined with cardiorespiratory training. Because the goal is not for hypertrophy or to gain maximal strength and power, the client only needs to be cycled through the first 2 phases of the OPT model: stabilization endurance training and strength endurance training. The client will start in phase 1 to ensure proper muscle balance and endurance of the stabilization muscles. He or she will remain there for approximately 4 weeks before moving on to Phase 2. The client then cycles back and forth between Phases 1 and 2 from month to month. Phase 2 will promote times of greater metabolic demand and more volume for increased caloric expenditure. Phase 1 will allow the client proper recovery time before entering back into Phase 2. Performing the workouts in a circuit training fashion can also help enhance caloric expenditure. Keep one's physical capabilities in mind before implementing circuit training. Cardiorespiratory exercise should also be included into the routine utilizing Stage 1 training, 65 to 75% intensity to start. As the individuals obtain higher levels of cardiorespiratory efficiency or begin hitting a plateau, they can progress to Stages 2, 80 to 85% intensity, and 3, 86 to 90%. Cardio can be performed on the OPT workout days or any other day during the week depending on the client's schedule. The goal of increasing lean body mass, or hypertrophy, requires higher volumes of training to force muscles to increase their cellular makeup and produce increased size. With the goal of hypertrophy, the client can be cycled through the first 4 phases of the OPT model depending on the needs and wants of the client. The client will start in Phase 1 to ensure proper muscle balance and endurance of the stabilization muscles. He or she will remain there for approximately 4 weeks before moving into Phase 2. Phase 1 is vital for this client, since it will prepare the connective tissues and muscles for the high demands of training required for this goal. Without proper preparation, injury will be imminent. Phase 2 will promote greater strength endurance and more volume to prepare the client for the greater demands of Phases 3 and 4. Phase 3 is specific for maximal hypertrophy and will place larger volumes of stress through the body to force cellular changes that result in muscle hypertrophy. Phase 4 is used to increase the strength capacity to allow the client to train with heavier weights in the future. This will also equate to higher volumes of training and greater hypertrophy. Returning to Phase 1 will allow the client proper recovery time before entering back into Phases 2 through 4. Cardiorespiratory training can be performed each month to ensure the cardiorespiratory system is efficient and promoting optimal tissue recovery. This may, however, require a larger amount of caloric consumption to ensure the individual has ample amounts of calories to support the demands being placed upon the muscle for optimal growth. This will be discussed further in the nutrition section of this course. The goal of improving general performance requires the client to increase overall proprioception, strength, and power output. The training will need to be progressed from stabilization through power phases of training and utilize the entire OPT model. However, for the typical athlete, Phases 1, 2, 4, and 5 will be the most important. The client will start in Phase 1 to ensure proper muscle balance and endurance of the stabilization muscles. He or she will remain there for approximately 4 weeks before moving on to Phase 2. Phase 1 is vital for this client, as each will prepare the connective tissues and muscles for the high demands of training required for this goal. Without proper preparation, injury will be imminent for the athletic client. The remainder of the plan shows the client cycling through Phases 1, 2, and 5. Phase 2 will promote greater overall strength and more volume to prepare the client for the greater demands of Phase 5. Phase 4 can be used to increase the strength capacity of the client, but is not vitally necessary for general performance. From the month of May on, Phases 1 and/or 2 and 5 are used in the same month or week. This is a hybrid form of periodization known as undulating periodization. Undulating periodization allows the client to train at various intensities over the course of a week, eliciting multiple adaptations once a certain level of fitness is achieved. In this program, stabilization, Phase 1, strength, Phase 2, and power, Phase 5, are all being trained together. Cardiorespiratory training can be performed each month to ensure the cardiorespiratory system is efficient and promoting optimal tissue recoverability. The key with the cardiorespiratory training is that one is not incorporating high-intensity cardiorespiratory training on the same day as a high-intensity OPT workout, particularly during the undulating period. For example, when performing a Phase 5 OPT workout, the cardio program for that day should be a Stage 1 workout. This will decrease the risk of overtraining. Summary. In summary, health and fitness professionals must be competent at designing training programs for a variety of clients, using acute variables and exercises in a structured, progressive manner. A structured, scientifically based program design model makes this easy. The Optimum Performance Training, or OPT model, provides the health and fitness professional with a proven system where a client's information can simply be plugged in. Acute variables determine the amount of stress placed upon the body and, ultimately, what adaptation the body will incur. Acute variables include repetitions, sets, training intensity, training volume, repetition tempo, rest interval, exercise selection, exercise order, training duration, and training frequency. Planned fitness training, or periodization, shifts the focus of a training program at regularly planned intervals of time to vary stress placed on the body in order to produce adaptation and prevent injury. The different levels of training seen in a traditional periodization model include anatomical adaptation, hypertrophy, maximum strength, and power. In the OPT model, these are simplified into stabilization, strength, and power. These are further broken down into 5 different phases of training. The stabilization level consists of one phase of training. Phase 1, Stabilization Endurance. This phase focuses on increasing core stability and endurance of all major muscles. It also optimizes the amount of continuous blood flow in the muscles during exercise to reduce tissue adhesions. The phase usually lasts for 4 weeks. The second level, Strength, is designed to increase strength endurance, muscle size, and strength. The strength period of training in the OPT model consists of 3 phases. Phase 2, Strength Endurance, Phase 3, Hypertrophy, and Phase 4, Maximal Strength. Phase 2 uses superset techniques with high volume for about 4 weeks. Phase 3 stresses maximal hypertrophy, focusing on high levels of volume with minimal rest periods for about 4 weeks. Phase 4 focuses on increasing the load placed upon the tissues of the body for about 4 weeks. The third level of training, Power, is designed to increase the rate of force production. To develop optimum levels of power, it has been shown that individuals must train both with heavy and light loads at high speeds. The power level consists of one phase of training, Phase 5, Power. This phase focuses on both high force and velocity to increase power and also lasts about